Polycystic Ovary Syndrome, universally known as PCOS, is the most common endocrine disorder affecting women of reproductive age. It is a complex hormonal and metabolic condition that impacts between 8 and 13% of women, though many remain undiagnosed. PCOS is not a disease of the ovaries, despite its name. The name is misleading because it focuses on just one potential characteristic: the appearance of multiple small follicles on the ovaries, which are often mislabeled as cysts. At its core, PCOS is a whole-body condition driven by hormonal imbalances, particularly an excess of androgens, often called male hormones, and often insulin resistance. A diagnosis of PCOS can feel confusing and overwhelming, but it is a manageable condition. Understanding what it is and how it affects your body is the first and most powerful step toward managing your health, advocating for your needs, and living a vibrant, healthy life. PCOS is a syndrome, which means it is a collection of signs and symptoms that can manifest differently in different people. There is no single test to diagnose it. Instead, doctors use a set of criteria, most commonly the Rotterdam criteria, which require at least two of the following three features to be present. 1. Irregular or absent menstrual periods. This is a sign of ovulatory dysfunction. It means you are not ovulating or releasing an egg regularly. This can present as very long cycles, infrequent periods, or a complete absence of periods. 2. Hyperandrogenism. This refers to high levels of androgens in the body. This can be identified either through a blood test showing elevated levels of hormones like testosterone or through clinical signs on your body. These signs include hirsutism, which is excess coarse hair growth on the face, chest or back, severe persistent acne, especially along the jawline, and androgenic alopecia, which is male pattern hair thinning on the scalp. Polycystic ovarian morphology on ultrasound. This is when an ultrasound reveals that one or both ovaries have 12 or more small follicles, typically less than 10 millimeters in size, arranged around the periphery. It is crucial to understand that these are not true, large cysts. They are small, immature egg follicles that have been arrested in their development due to the hormonal environment. Based on these criteria, a woman can have one of several different phenotypes or presentations of PCOS, which explains why one woman's experience with PCOS can be so different from another's. The exact cause of PCOS is not known, but it is understood to be a complex interplay of genetic and environmental factors. Researchers have identified several key drivers of the condition. Insulin resistance. This is a central feature in a majority of women with PCOS, affecting up to 70%, including those who are not overweight. Insulin is a hormone that helps your body use sugar from food for energy. Insulin resistance means your body's cells do not respond properly to insulin. To compensate, your pancreas produces more and more insulin. These high levels of insulin are problematic. They signal your ovaries to produce more androgens, like testosterone, which disrupts ovulation. They can also contribute to weight gain, which further worsens insulin resistance, creating a vicious cycle. Hormonal imbalance. Women with PCOS have a disruption in the communication between the brain and the ovary. There are often altered levels of luteinizing hormone, or LH, and follicle-stimulating hormone, or FSH, which are the two key hormones from the brain that regulate the menstrual cycle. This imbalance, combined with the high levels of androgens from the ovaries, prevents follicles from maturing properly and releasing an egg. Genetics. PCOS has a strong genetic component and frequently runs in family. If your mother or sister has PCOS, you have a higher risk of developing it. Researchers have identified several genes that may be associated with the condition, many of which are involved in hormone production and insulin regulation. Low-grade inflammation. Studies have shown that women with PCOS often have a state of chronic low-grade inflammation. This inflammation can stimulate the ovaries to produce more androgens and may also contribute to insulin resistance. The clinical journey of this lifelong condition. The cosmetic symptoms, like acne and hirsutism, can have a significant impact on self-esteem during these formative years. The primary concern for many women with PCOS during their reproductive years is infertility. Because PCOS disrupts ovulation, it is one of the most common, but also one of the most treatable causes of infertility. Beyond the reproductive years, PCOS is associated with significant long-term health risks, primarily related to its metabolic aspect. These risks include type 2 diabetes, Due to the high prevalence of insulin resistance, women with PCOS have a much higher risk of developing prediabetes and type 2 diabetes. Cardiovascular disease. The condition is linked to an increased risk of high blood pressure, high cholesterol, and heart disease. Endometrial cancer. Because women with PCOS do not ovulate regularly, the uterine lining, or endometrium, is not shed regularly through menstruation. This can lead to a thickening of the lining, a condition called endometrial hyperplasia, which can increase the risk of endometrial cancer if left unmanaged. Mental health conditions. Women with PCOS have a significantly higher rate of anxiety and depression. This can be due to the hormonal imbalances themselves, the stress of dealing with a chronic illness, the cosmetic symptoms or challenges with fertility. Recognizing the symptoms of PCOS. Common symptoms include irregular menstrual cycles. This is the most common sign. It can mean having fewer than 8 periods a year, having cycles that are longer than 35 days, or failing to menstruate for 4 months or longer. Hirsutism. This is the growth of coarse dark hair in a male-like pattern on the face, chin, chest, abdomen, or back. Acne. Severe, persistent acne that does not respond well to typical treatments, especially when it is located on the jawline, chin, and upper neck. Hair loss. Thinning hair on the scalp in a male pattern, often at the temples or the crown of the head. Weight gain and difficulty losing weight. Many women with PCOS find it very easy to gain weight, particularly around the abdomen, and very difficult to lose it. Darkening of the skin. Patches of dark velvety skin, a condition called acanthosis nigricans, can appear in body folds and creases like the neck, groin, and under the arms. This is a sign of significant insulin resistance. Getting professional help. Diagnosis and evaluation. If you are experiencing symptoms of PCOS, it is important to see a healthcare provider who is knowledgeable about the condition. This could be a gynecologist, an endocrinologist who specializes in hormones, or a reproductive endocrinologist if your primary concern is fertility. The diagnostic process is one of exclusion, meaning your doctor will first rule out other conditions that can cause similar symptoms, such as thyroid disorders or other hormonal issues. The evaluation typically includes detailed medical history. Your doctor will ask about your menstrual cycle history, your symptoms, and your family history. 2. Physical exam. Your doctor will check your blood pressure, weight, and look for physical signs of hyperandrogenism like acne and hirsutism. 3. Blood tests. A panel of blood tests is essential. This will include tests for androgen levels, like total and free testosterone, DHEAS, and blood sugar and insulin levels to check for insulin resistance. Your doctor will also check your thyroid function and prolactin levels to rule out other causes of irregular periods. 4. Pelvic ultrasound. A transvaginal ultrasound is used to look at the ovaries to see if they have the characteristic polycystic appearance. It can also be used to measure the thickness of the uterine lining. A diagnosis is made based on the Rotterdam criteria after other conditions have been ruled out. There is no cure for PCOS, but its symptoms and long-term health risks can be very effectively managed. Treatment is highly individualized and focuses on your specific goals, whether that is regulating your period, improving cosmetic symptoms, or achieving pregnancy. The cornerstone and first-line treatment for PCOS is lifestyle modification. Diet. The focus is on a diet that helps manage insulin resistance. This generally means a balanced, whole foods diet that is low in processed carbohydrates and sugar. Many women find success with low glycemic index diets or a Mediterranean-style diet. Exercise. Regular physical activity is crucial. A combination of aerobic exercise and strength training helps improve the body's sensitivity to insulin, can aid in weight management, and can lower androgen levels. Medical treatments are used in conjunction with lifestyle changes for regulating menstrual cycles. Hormonal birth control pills are often prescribed. They regulate the menstrual cycle, reduce the risk of endometrial cancer, and can also help with acne and hirsutism by lowering androgen levels. For managing insulin resistance, the medication metformin, a drug commonly used for type 2 diabetes, is often prescribed for women with PCOS. It helps improve insulin sensitivity, which can lower androgen levels, restart ovulation in some women, and aid in weight management. For cosmetic symptoms, besides birth control pills, a medication called spironolactone can be used. It is an anti-androgen that can be very effective at treating hirsutism and acne. For fertility, for women trying to conceive, the first-line treatment is often an oral medication called letrozole, which helps induce ovulation. If that is unsuccessful, injectable hormones, or in vitro fertilization, known as IVF, are other options. Rehabilitation and living well with PCOS. Living with PCOS is about long-term management and building a sustainable, healthy lifestyle. Rehabilitation is not about recovering from a single event, but about learning to manage a chronic condition. This involves regular checkups with your doctor to monitor your metabolic health, including your blood pressure, cholesterol, and blood sugar. A huge part of living well with PCOS is managing the mental and emotional impact. The challenges with weight, appearance, and fertility can take a significant toll on self-esteem and mental health. Finding a supportive community, whether through online groups or local support networks, can be incredibly helpful. Working with a therapist or counselor can provide you with tools to cope with anxiety and depression. It is about shifting the focus from curing the condition to nourishing and supporting your body through mindful eating, joyful movement, and self-compassion. PCOS research is a dynamic and expanding field. Scientists are exploring the intricate connections between genetics, the environment, and the development of the syndrome. There is exciting research into the role of the gut microbiome, the community of bacteria in your intestines, and its connection to inflammation and insulin resistance in PCOS. This could open the door to new therapies involving probiotics and dietary intervention. Leading experts in the field advocate for a holistic, patient-centered approach. Dr. Anuya Dalkras, a leading PCOS researcher and the director of the Penn PCOS Center, emphasizes the need to treat the whole person, not just the individual symptom. Her work often highlights the importance of screening for and treating the mental health conditions associated with PCOS. In a publication for the American College of Obstetricians and Gynecologists, or COG, she co-authored guidelines that stress the importance of lifestyle management as the foundation of care. The International Evidence-Based Guideline for the Assessment and Management of PCOS, a massive collaborative effort, provides a clear consensus from experts worldwide. A key recommendation from the guideline is a focus on health-related quality of life, stating that PCOS has a significant negative impact on quality of life and a high prevalence of moderate to severe anxiety and depression. This acknowledges that the psychological burden of the condition is just as important to treat as the physical symptoms. The expert message is one of empowerment. While PCOS is a complex and chronic condition, it is highly manageable through a combination of lifestyle changes, appropriate medical support, and self-advocacy. You can control your symptoms, reduce your long-term health risks, and live a full, productive, and healthy life.